Hey guys, welcome back. Okay, so today this is going to be the leg and knee palpation for the class. So we have our lovely model, Allie again. Wave. There she is. All right, somewhere. So we're going to start at the patella, really easy to find patella. So again, in full knee extension, the patella floats on top of the femur so we can wiggle it. So we can do a little medial lateral glides, a little superior inferior glide. So I'm just going to use my mark here and put some labels here. We're going to kind of rotate Allie just a little bit so you can see. You don't have to do this in the exam, I'm just doing it for the video here. So we're going to be able to isolate right there is the superior pole patella. Come back down here, that's the inferior pole. There's our medial and lateral border. So that's basically the outline of our kneecap right there. Then we have quadriceps tendon, patellar tendon, inserting into the tibia tuberosity. So once you kind of get that, you can actually isolate where all these structures are. Alright, so we have quadriceps tendon coming in from the quadriceps, our two borders of the patella, and the inferior superior pole of the patella, our patellar tendon, and then our tibia tuberosity. Very quick and easy way of manipulating and moving through the patella. Now we're going to have Allie sit up and face me with a bent knee. And you can see our marks basically stay where they are. They might be a little bit off, but they basically stay where they are. Now I'm going to raise her up a little bit. It's nice when you have an easy table to do this. So now we're still in this position here, all right? So from here, I can still palpate my borders, and now I can palpate the lateral and femoral condyles, prominent rounded condyles. I can take my fingers and drop down right here into the tibial plateaus. Tibial plateaus are where your meniscus sit, all right? So I can get the condyles in the tibial plateau. Adductor tubercle. We come to the medial femoral condyle. I'm going to palpate superior, posterior, and deep. Okay? You can see I am really on the medial side of the knee because that's where the adductors are. Okay? Don't end up here. That's quadriceps. We really need to rotate, come all the way medial and posterior and get right back in there. That's where the adductor tubercle sits. Quadriceps patellar tendon, all the borders of our patella are tibial plateaus. Now the last thing we're going to do is I'm going to actually pop her knee right up like this. Alright? And these are the areas that our tendons insert. Can't really palpate. We're going to find the general areas. First one is pes anserine. We're going to find our tibial tuberosity. We're going to find our tibial plateau. So it's basically, there's the tibial plateau, comes like that. There's the tibial tuberosity. This spot right here, that soft little landing spot, that's going to be pes anserine, this little anterior medial tibial area. On the lateral side, we're going to find there's the plateau, there's the tibia tuberosity. This soft area right here is Gerdy's tubercle. Okay? And on the last thing we're going to do is we're going to follow that tibial plateau all the way to the lateral side, and I'm going to drop down. Drop down right here, and there's fibular head. If I have her actively evert her ankle, you can see, relax, you can see the peroneus longus muscle coming out. You can also see fibular head in relation to the tibial plateau, okay? Let's see if I can make it, you can see that. There it is. All right? So there is a difference. Fibular head is not way up here. You have to drop down a little bit. Once you understand and can manipulate and move your way all around the anterior and lateral knee, all the ligaments, all the insertion of the muscles, it's just connecting the dots. But make sure you feel comfortable manipulating and moving your way around the knee. Okay?